Well, good morning, everyone. My name is Jim Blando, and I'm a faculty member at Old Dominion University located in Norfolk, Virginia. Today, we're going to talk about an overview of exposure and risk management. One of the things that's important for us to make a note of is this discussion is really focused on the methodologies and the framework that US EPA, the United States Environmental Protection Agency, uses in the management of environmental risks. That'll be sort of the focus of this presentation. So our learning objectives today are to understand some of the broad concepts of exposure and risk management, to review some strategies for exposure and risk management, and to understand how uncertainty in exposure assessments impacts exposure and risk management. The first question is, what is exposure and risk management? There is a difference between exposure assessment and risk assessment versus exposure management and risk management. As you'll note on the slide here, assessment is focused on the utilization of data to characterize the exposure and the risk. Management is focused on what you will do about the exposure and hence the risks involved. Assessment and management are two very distinct and separate activities by design as per US EPA's framework. The assessment of exposure and risk should not be influenced by the practicality of the management options. In other words, the assessment is what the risk is and a quantitative assessment of that risk, and management is what you're going to do about that risk. They are separate. And in particular, it's important that the assessment is not influenced by the challenges associated with managing that risk. So in other words, when we conduct risk management activities, if we find that the management techniques that are required are difficult for us to do, we don't want that to influence our assessment of the risk or, for example, downgrade the level of risk simply because the management techniques that are required are somewhat challenging or difficult to implement. The risk assessment and the exposure assessment, the data is what the data is, whereas the management is what you're going to do about that risk, and the requirements of that management should not influence the overall assessment of that risk or exposure. So they are separate activities, and it is important by EPA's framework to keep them as separate, distinct activities. Again, assessment is focused on quantifying and characterizing the risk and the exposures. Management is focused on what are you going to do about those risks and exposures. Management does make value judgments about how much control you need and the resources available to implement those controls. So we do make value judgments about the resources that will be expended in controlling a risk and how much risk is acceptable. Management is also focused on the strategies and techniques that you utilize to control the exposures and risks, and these can be highly variable depending on your specific scenario. A schematic that visually demonstrates exposure and risk management as a process is presented on this next slide, and you can see that this overall schematic of the EPA exposure and risk management process, you can see that risk management is towards the back end of that process. You'll note that it's circled here in red. What's important to note about this particular schematic is that risk management has a sort of feedback loop that goes back to the beginning of the process. And the reason for this is because at times we find that we always need to check to be sure that our risk management techniques that we've decided to utilize, we want to make sure that, number one, it's effective. We've actually addressed the particular hazard of concern. But in addition, we also want to be sure that our risk management techniques do not result in any new hazards. So, for example, we had a scenario where we had a Legionella outbreak in a building. Of course, as many of you probably are aware, one way to deal with Legionella is to remove all the dead legs in a water distribution system so you don't have stagnant water. Therefore, a risk management decision was made to have plumbers come in and remove all of the dead legs. What wasn't recognized initially in that assessment of that hazard in that facility was that the pipes were coated in asbestos. So the inspectors came in, the plumbers came in, they removed the dead legs on the pipes in the building and ended up spreading asbestos throughout the building because they just ripped the insulation off without any controls for the asbestos. So that's an example where our risk management, we have to reevaluate what we're doing just in case any new risks emerge as a result of the risk management practices that we employ. So that is a very, very important thing for us to keep in mind. We should always check to be sure that our risk management techniques are effective and they don't create any new hazards. So management strategies and techniques, as sort of a general overview, it's important to point out that really there is no one single approach or formula. In fact, what we decide to do to manage exposures and risks is highly dependent on the specific scenario before us. We may actually decide to use multiple approaches. Every approach that we utilize has advantages and disadvantages. Also, we typically have to decide on our approach in regards to the level of control that is actually needed. So a goal would be set for risk management, and to meet that goal, depending on what goals are set, that will impact what decisions are made and what controls are put in place. It's often very multidisciplinary, can have a need to involve multiple disciplines, including engineers, scientists, as well as clinicians might be necessary for a management strategy to be implemented. Sometimes risk management strategies and techniques are multidisciplinary in nature. Oftentimes they're driven by regulatory drivers. For example, there may be performance or specification standards that require certain management techniques to be implemented. If that is the case, that oftentimes will drive the risk management strategy that's implemented because there are regulations that require it. Also, as discussed already in the previous slide, this is oftentimes driven by value judgments on what is acceptable exposure and risk. So essentially what we have when we talk about risk and exposure management, sometimes we do find that we do have to make hard decisions about what we're going to implement. And oftentimes we'll have to prioritize what those management techniques will be that will be implemented, simply because resources are oftentimes limited. And therefore, sometimes we have to make hard decisions about what we can practically do in terms of managing a risk. As often has been said, this sometimes can be an art and often involves judgment. And oftentimes there aren't clear and easy choices, especially when you have resource limitations. So, for example, this idea of using value judgments sometimes is hard for scientists and engineers to accept because oftentimes we're looking for very discrete quantitative numbers to help us make decisions. But we must remember that these value judgments are oftentimes important in terms of what's socially acceptable to communities and people that we are engaged with. We had this pointed out to us one time by a governor who was looking at things politically. And I know many of the scientists in the room were sort of hesitant to accept his statement. But in the end, if you really think about it, he was actually right. If something is not acceptable by the community, the people that you're trying to help, it may not be effective. So we do have to account for value judgments when we're thinking about making management strategies and implementing them. So another way that we can oftentimes think about exposure and risk management, we can sort of put it in the framework of what our epidemiologists oftentimes refer to as the epidemiologic triad. As you may recall from epidemiology, the triad is basically the interaction and overlay of three major factors that impact whether an adverse outcome will occur. This may include, on one corner of the triad, what we oftentimes refer to as agent factors, right, which are characteristics about the particular contaminant or agent that can result in hazard. This would be, for example, the toxicity of a chemical. Some chemicals are more toxic than others. This could be the virility of a virus. How much of a hazard does a given virus represent in terms of its ability to cause disease? So that is one significant impact in terms of determining what and if an adverse outcome will occur. We also can look at the environment, which is how are people exposed to these various hazardous agents and how much are they exposed to? And we can look at various host factors. These are characteristics about the person who is being exposed. Is the person sensitive to a given agent? A classic example of that would be allergies. Some people have allergies and some people don't. I have pretty significant grass allergies, so when I cut the grass, if I don't wear a mask, I'll be sneezing and my eyes will be bothering me and so on, whereas somebody who doesn't have a grass allergy may not have a problem. So therefore, the interplay of these agent, environment, and host factors all sort of come together to predict whether there would be an adverse outcome as a result of a given exposure. So one way we can think about risk exposure management is how can we break up this triad? How can we break this epidemiologic triad so that we disconnect these three major factors such that they can't influence and contribute to an adverse outcome? And we can think about this framework when we think about what kind of controls can we put in place in a very broad sense. With that said, there are many factors that will impact what type of management decisions one may make. There are technical factors and non-technical factors. Of course, we have the technical factors that are going to impact management decisions. This includes the factors listed here on the slide. How much do we know about a given topic? Sometimes we find out things that we didn't know previously, and that changes our assessment of the risk and the assessment of what management decisions we're going to make. For example, it may not have been known years ago that a certain chemical had toxic properties. There are many chemicals that were originally thought to have low toxicity, and over time we have found that they are more toxic than we originally thought. So that can be a technical factor that can impact management decisions. That knowledge is dynamic and changes over time, and we might want to try to keep that in mind when we're making management decisions. How accurate and detailed and the scope of our assessments are can certainly impact management decisions. Sometimes we may look at a scenario and think that it's a very limited risk or limited to a very small population, and therefore our assessments may be limited in detail and scope, providing us with a little less knowledge and maybe a little bit more uncertainty. However, there may be other scenarios where things are evaluated very carefully and in a very detailed way. As I've already mentioned, uncertainty certainly is going to impact. We will continue to talk about uncertainty and its impacts that it may have on your management decisions. Certainly, the more uncertainty you have, the more caution you may exercise just because of that degree of uncertainty. Technical feasibility of controls. We may have control strategies that we want to put in place, and at times we may find that we may be limited with the technology that we have available to us, therefore limiting the controls that we can implement. Effectiveness and efficacy of controls, that will vary by control strategy that is implemented. Some controls are more effective than others. Hence, some controls are more expensive than others to implement. So many of those factors are going to be important decision points in terms of determining your management strategy. Potential impacts of the controls, are they going to impact or impede a community from activities that are daily living? For example, do I put a control in place and close a roadway down? Well, that may impact people's ability to get to work and so on. So controls can have an impact. Again, regulatory requirements are specified in the regulations. We have to comply with regulations, so that can certainly drive management decisions. And of course, cost, budget, return on investment, how expensive things are, what resources you have available, and what return on that investment are you likely to see. These are all technical factors that are going to impact what management decisions you make. There are also many non-technical factors that impact management decisions. These can be really significant factors that can greatly impact the management strategy one selects to address a given exposure or risk scenario. Public and worker acceptability and perception of the controls, knowledge, attitudes, and beliefs, right? It is not likely for a control or a risk management decision to be effective if nobody is willing to participate in that control strategy. If people do not believe that a control strategy will actually be helpful, or that the risk or the hazard or the exposure is actually dangerous, if people do not believe that, they may be less likely to participate in your management approach. For example, if someone does not believe that smoking causes lung cancer, it may be much more difficult to get them to stop smoking. Now, one of the things that's become much more prevalent in recent years and with the advent of social media is the impact of misinformation. Misinformation availability to your stakeholders can certainly impact their perceptions of the hazard and the risk, which may impact their willingness to participate in the control strategy that you are trying to implement. A good example of this is the COVID-19 pandemic. Certainly, if you incorrectly believe that the COVID vaccines are ineffective, then you're less likely to get a vaccine. So misinformation can have a significant impact, and this is something that I think our regulatory agencies and our public health professionals have had to spend a significant amount of time trying to correct, and it can be very difficult to correct that misinformation. Certainly the political landscape, our government agencies and the way our system of government operates, it operates in a political framework, and consequently political considerations can be introduced into what management decisions will be made. Some administrations may be more politically inclined to support the needs of industry and profit-making motives than other political entities. So that can certainly impact the regulatory structure, enforcement, and approaches that one may take. Public and worker awareness, impact of news, social media, and the news cycle. Certainly, we have done several studies where we have found that, in fact, it's not uncommon for people to highly value what they see among their friends and their friends' opinions whom they're connected with on social media, right? And certainly what they see in their news cycle as well. We did a study once looking at the safety and risks associated with prenatal hot yoga, which are pregnant women that expose themselves to very high temperatures and humidities while doing yoga. And we actually found that the women participating in this activity were more likely to believe their yoga instructor in terms of the risks and hazards associated with hot yoga while pregnant than they believed from their obstetrician. They trusted their yoga instructor more than their obstetrician in terms of the hazards and risks associated with hot yoga while pregnant. And this has to do with a lot of what our sociologists and our psychologists talk about in terms of the way people value their friends and the relationships that they have. Certainly awareness of technologies that are involved, that can certainly impact public and worker awareness. And of course, that's going to impact their willingness to participate in your management decisions. Of course, our business needs as well. Certainly corporations and businesses are going to be looking at liabilities. One thing we oftentimes try to point out to our stakeholders on the business front is that we have to keep in mind there are expenses for unaddressed risks resulting in injuries and so forth. Things like workers' compensation resulting from workplace hazards. That's certainly a liability that businesses are going to be concerned about, and that certainly can emphasize their interest and desire to participate in management controls. Certainly, if they see a liability, they'll be more inclined to participate. Businesses, of course, are concerned about their public image. However, with all that said, sometimes there can be a disconnect between the business model and the public health model. Business model, they're looking at profits. Public health model, we're looking at protection of the public and are less sensitive to profits and monetary motivations. So sometimes that can result in a conflict between public health agencies and businesses as well. These are all non-technical factors that will significantly impact management decisions and implementation. And again, important to just keep in mind that non-technical factors sometimes can have more of an influence than technical factors in terms of management decisions that are made. So we always want to be cognizant of that as well. So just to summarize, exposure and risk management is key to public health protection. Exposure and risk management is part of a systematic process, and there are many technical and non-technical factors that impact management decisions.